Hello everyone, welcome to my channel White Code Wisdom. Today I will discuss about ABG analysis and its implications in clinical practice. This topic is cornerstone in clinical decision making, especially in the critical care and emergency settings. Understanding ABG values not only help us interpret a patient's respiratory or metabolic status, but also guide timely and appropriate intervention. Let's get started with the basics of what ABG analysis is and why it is so crucial in clinical practice. Introduction to ABG analysis. Arterial blood gas analysis measures the level of oxygen, carbon dioxide, and acidity in the blood. It is essential for assessing a patient's respiratory function and metabolic state, and playing a vital role in clinical diagnostics. Why is ABG important? ABG analysis is crucial in managing patients with respiratory and metabolic disorders, aiding in decision making for treatments such as oxygen therapy and ventilator settings. It assists in monitoring the effectiveness of therapeutic interventions. Key parameters in ABG. ABG analysis evaluates multiple parameters including blood pH, partial pressure of oxygen and carbon dioxide, and bicarbonate levels. Understanding these parameters is essential for interpreting a patient's acid-base balance accurately. Moving on further, let's see about understanding ABG parameters. What is pH? pH indicates the acidity or alkalinity of blood. Normal arterial blood pH ranges from 7.35 to 7.45, with values below or above indicating acidosis or alkalosis, respectively, which can disrupt physiological functions. Understanding the partial pressure of carbon dioxide. PaCO2 measures the effectiveness of ventilation. Normal values ranges from 35 to 45 mm of Hg. Increased level can suggest respiratory acidosis, while decreased levels indicate respiratory alkalosis. Role of PaO2. Partial pressure of oxygen reflects the oxygen availability for tissues. Normal values range from 75 to 100 mm of Hg. Levels below this can indicate hypoxemia and necessitate immediate assessment and intervention. Importance of HCO3 ion. Bicarbonate ion is a key buffer in the blood, helping to maintain pH balance. Normal levels are between 22 and 28 milliequivalent per liter. Abnormal levels can indicate metabolic acidosis or alkalosis, guiding treatment decisions. Understanding about base excess. Base excess quantifies metabolic acidosis or alkalosis and reflects the amount of excess or insufficient base in the blood. A normal range is -2 to +2 milliequivalent per liter, and deviations can indicate the need for therapeutic interventions. Next is some of the clinical examples of ABG analysis. Normal ABG values. Normal Arterial blood gas values are crucial for evaluating a patient's respiratory and metabolic status. A typical pH range is 7.35 to 7.45. PaCO2 is 35 to 45 mmHg. PaO2 is 75 to 100 mmHg. And HCO3 is 22 to 26 milliequivalent per liter and base excess between -2 to +2 milliequivalent per liter. Respiratory acidosis. Respiratory acidosis occurs when the body accumulates excessive carbon dioxide, leading to decreased pH levels. Common causes include chronic obstructive pulmonary disease and respiratory distress resulting in pH values below 7.35 with elevated PaCO2 levels. Metabolic acidosis is characterized by a decrease in bicarbonate concentration in the blood, often due to conditions such as diabetic ketoacidosis or renal failure. pH measurements are typically below 7.35 and HCO3 levels are decreased. Respiratory alkalosis occurs when there is excessive loss of carbon dioxide, leading to elevated pH levels. This is often linked to hyperventilation from anxiety or hypoxia, resulting in pH values above 7.45 and low PaCO2 levels. Metabolic alkalosis involves an increase in bicarbonate or a loss of hydrogen ion, often caused by vomiting, diuretics, or certain endocrine disorders. pH exceeds 7.45 with elevated HCO3 levels, impacting overall metabolic function. Now let's see about the implications of ABG analysis. Diagnosis and management. ABG analysis aids in accurate diagnosis of acid-base and respiratory disorders. Clinicians use results to tailor management plans, guiding treatments for conditions like COPD, metabolic acidosis, and respiratory failure. Monitoring therapy. ABG analyses are essential for monitoring patients undergoing respiratory therapy such as mechanical ventilation. Adjustment to treatment protocols are often based on continuous ABG results, ensuring optimal patient outcome. Patient outcomes. Effective ABG analysis correlate with improved patient outcomes, particularly in critically ill patients. Early intervention based on ABG results can significantly reduce morbidity and mortality rates. Case studies. Numerous case studies demonstrate ABG's critical role in patient care. For example, early detection of hypoxia through ABG led to timely interventions and drastically improving recovery trajectories. Future directions. The future of ABG analysis include advancements like point-of-care testing and integration with digital health technologies. Such innovations promise to enhance accessibility and accuracy in patient assessments. This is all about the ABG analysis, definition and parameters, and what are the implications in clinical practice. Thank you for watching the video. I hope it helped clarify the key concepts of ABG analysis and its implication. If you have any question or thought, feel free to share.